Okay, so my name is Eddie, and I'm going to go ahead and start my NG2 insertion. So the way I do it is, I want to first look at my physician's orders and verify that I have the right patient, the name, the date of birth, and the right procedure that I'm doing. So I have Jack Buzzard, 620 19XX. I'm doing an NG insertion. So I go into the patient's room. Can you verify your name and your date of birth? Okay, awesome. And I'll look at the wristband and verify, and then I assess for allergies. Once I assess all those things, I want to go ahead and put the bed to a working height, high Fowler position, lower the side rail down. I'm going to be at the side to where my dominant hand is closest to the patient. And a quick consideration with the tape that was in one of my bags. While I was practicing, it doesn't really stick well with the simulation nose, but I'm gonna do the best I can. It works okay. I'll say that it works okay. So I have my clean gloves on. After I perform my hand hygiene, I want to assess for a cough and a gag reflex. So I assess for cough, and I assess for gag reflex using my tongue blade. So good, good reflexes. And what I'm going to do is I'm going to look for which nair I want to go to. So I want to avoid a nair that's undergone surgery or has any injury to it. I want to go with the nair with the greatest airflow. I'm gonna check for patency, and the way you check for patency is I'm gonna put one finger on one nair at a time. Tell the patient take a breathe in. Again. Okay, and then I'm going to look for any, I'm gonna use my pen light to check for any polyps or lesions. While I'm here, I might as well just check the oral cavity, look for any obstruction, anything that might cause complications in this procedure. So everything looks good. So I use my pen light. So now I can go ahead and prepare the patient's bedside. I'm going to advise the patient, if you feel, Jack, if you feel any uncomfortable with this procedure, I want you to raise your finger if you feel uncomfortable, if you feel like gagging. I'm going to put a towel over the patient's chest. I'm going to provide him a drinking water, which I will look at his chart to see if he's NPO or not, which he's not, so he can have the drinking water. I'm going to have a emesis basin, some tissues. And so once I have his stuff set up, now I'm going to get my side set up. So I'm going to prepare my bedside, so which I have my my tape to measure my my ruler to measure my tape. I'm going to have my scissors to cut my tape. I'm going to have my tape, and I'm going to have a lubricant with me. I'm going to have a patient, and I'm going to have my NG2. Okay, so once I have my bedside set up, I want to prepare my tape. So I'm going to have 3 different pieces of tape. One tape is going to be attached to the nose to sling the NG tube to the nose. I can find it. Okay. So I'm going to use my tape. Okay, and I'm going to cut it. So I am going to cut 2 inches right down the middle. Making pants. Verify with the ruler that that is 2 inches. Okay, so I'll verify with the ruler that is indeed 2 inches, and the tape is 4 inches long. Now I'm gonna get two separate pieces of tape. One so I can attach the tube to the gown, and the other one so I can mark the tape to where the xiphoid process will be. And I'll put the tape on my bedside ready to use. So once I have that, I can go ahead and once I have my tape ready, I am now, just a reminder, I do have clean gloves, so I'm going to take my tube out of my packet. All right, and I'm gonna be careful not to contact it to the floor, the bed, anything as much as possible. So what I'm going to do is I'm going to measure. So I'm going to use myself. So the tip of the nose is at the tip of the tube. Go straight to the earlobe and then go straight to the xiphoid process. So we're going to go right here. So I'm going to mark my tape to where my index finger is. I'm going to tape the tape to each other, and that is where my marking will be, right here. So once I have it marked, I want to go ahead and dip my tube into some warm water and lubricate 4 inches of the tube. And what I'm going to do is I'm going to have the patient's neck hyperextended. Once it reaches the nasal pharynx, the patient's going to tuck their chin in. I'm going to have the patient, I'm going to encourage the patient to swallow. So here we go. So go ahead and stick it in. All right, Mr. Buzzard, we're going to go ahead and go right in. Do it quickly, smoothly, gently as possible. We're going to go in, and the patient tucks their chin in, go in, all the way until we reach that mark of the tape. So we have that tape mark right here. I'm not sure if you can see or not. The tape is really transparent, but it's right here. So I'm going to grab my pants and I'm going to attach it to the middle of the nose. Again, this tape is not really that good, but we're going to do our best. And so I'm going to get one piece of tape, attach it to the side, get the other piece of tape. I'm going to go along with the mark tape. They're going to go in the same side, going in the same direction. Go around. And just like that. Now I'm going to get my other piece of tape, and we are going to go the opposite direction. Opposite. And then from here, that is how you sling the tape. So I have that. So what I want to do next is I want to go ahead and attach my but before I do this, I want to do note that my NG tube was already clamped. I want to note that when you take it out the bag, that you want to clamp it, because if you stick that tube in, if it's not clamped, all the juices might come out. So when you want to keep it clamped. So mine came clamped, that's why I didn't mention it, but I do want to verbalize that. So once I do that, I want to use my other piece of tape, and I'm going to attach it to the gown. I wanna, so if this was me, I would attach it just like that. I don't want to attach it too tight. I want to give it some room like this. So and then I would pin the tape, not the tube. Okay, so once I pin that and my tube is clamped, I can go ahead and verify the placement of the tube with an x-ray. pH may be permitted or required depending on facility policy or procedure, but an x-ray still has to be done initially. Okay, so and then I'll put the bed to its lowest position, call light within reach, side rail up, put the patient in a supine or semi-Fowler position, whatever the patient wants, assess for additional needs, my expected time of return, take off my gloves, perform hand hygiene, document my date, the time, and the patient's response to the procedure. So now that I completed my insertion, I have another order to remove an NG tube, and we're in this case we're gonna use Jack Buzzard again. So before I even do anything, I want to verify with the orders. So I look at the orders. I want to verify the right patient. I'm doing it on the right date, the right name, the right date of birth, then once in the right procedure that we're doing it in. So I do see I have Jack Buzzard 19XX. We're doing it in May 21st, 2020. And we are doing an NG removal. So now I can go into the patient's room. Mr. Buzzard, can I have you verify your name and your date of birth? Awesome. Okay. Now can I go ahead and look at that wristband for me? So I verify with that wristband. Okay, so let's get started. So I put the bed to a working height, high Fowler position, lower the side rail down. Again, dominant hand closer to the patient. What I want to do first is perform hand hygiene, put some gloves on. If there is a flow of feeding running, I want to stop it. I want to flush it. I want to flush the tube. I want to disconnect from the wall mounts, and I want to clamp my NG tube, and then immediately discard my gloves, perform hand hygiene, put some new gloves on, remove the tape from the bridge of the nose, remove the tape from the gown, and then I can go ahead and get started on my removal. Again, I will have the patient's bedside ready. I would have a towel over the patient's chest. I will have tissue. I will have drinking water. And we verified before that Jack Buzzard is indeed not NPO, so he can have that drinking water in a messes basin, and again some tissues. So I will go ahead and I will tell Mr. Buzzard, can you go ahead and take a deep breath in and go ahead and hold it. Okay, so he's holding it. I'm gonna pinch the tube, and I'm gonna go completely out, smoothly, quickly, gently, and then the tube is out. I'm going to immediately dispose of the tube, dispose of my gloves, perform hand hygiene, put some new gloves on. I want to provide mouth care to Mr. Buzzard, a drinking water, because it's allowed. He's not NPO. Use warm water and soap, or adhesive remover to clean the bridge of the nose of Mr. Buzzard, and then return the bed to its lowest position, rail back up, supine or semi-supine position, whatever the patient desires. Assess for an additional needs, call light within reach, my expected time of return, take off my gloves, perform hand hygiene, document the date, the time, and the patient's response to the procedure. Okay, so I am confident that I completed that. So I can go ahead and move on to my ostomy. So my orders first is to say that I need to place an ostomy bag on Mr. Buzzard. So before I do anything, again, I want to verify with my orders that I am doing it in the right time, the right patient, date of birth, right procedure. So I have Jack Buzzard, 6/20/19XX. We are doing it in May 21st, 2020. We are doing a ostomy placement. So I want to go into the patient's room. Can I have you verify your name and your date of birth? Awesome. And can I look at that wristband? So I look at the wristband and make sure. After I make sure, I can go ahead and put the bed to its working height. I'm going to put the patient in a supine or semi-Fowler position. Lower the rail down to the side that I'm going to be working on, and then I am going to first measure my wafer. I'm going to perform hand hygiene, put some gloves on, measure my wafer. Now this is the only ruler I have. I didn't get the circular measurements, but I will note that my measurement will be 1/16 to 1. My wafer will be 1/16 to 1/8 inch larger than the stoma. So I did my verification. My stoma is gonna be my peach ring, because I didn't have I was looking for my stoma, but I couldn't find it. I'm sorry about that. But peach ring. It's so I measured my peach ring and everything, and so I grabbed my wafer. So with measuring my peach ring, it would be 45 millimeters. But I would verbalize that with my measuring guide. I would hover over the stoma to see what measurement it is. I do not want to touch. I do not want the stoma and the measuring guide to touch each other. So I measure over it, and it is 45 millimeters. So I go ahead and get my scissors. Again, I'm using the scissors that I got from school. These aren't really. These are kind of bulky. So, but I'm gonna, got to do my best. So I'm gonna cut right down the middle. Okay. Cutting along the line. Again, I perform hand hygiene and clean my gloves. I want to verbalize that. Okay, so I can dispose of this. So this is my stoma. Now, I would, since I have gloves on, I would rub my fingers together, and I would run my fingers along this to smooth it out. Because these jagged edges, they have a risk to you'll cut the stoma or irritate it. So I would smooth it out. Smooth it out, smooth it out. Smooth it out. Use my body heat to smooth it out. Fortunately, it's probably gonna take all day to smooth it out, but I would just verbalize that I would not place this if it had jagged edges. I would do it until it's completely smoothed out. I have 17 minutes. Okay. Well, I'm at 17 minutes. Okay. So I would smooth it out, smooth it out. Once it is completely smooth, I would get my ostomy bag and I would attach it to the bag. Okay, so now that I got my bag, I would go ahead and, of course, I'm not sure if I would clean it if I'm removing it, because the orders say just to place it, but I guess just in case, I would clean the area first by. Of course, I would have a different set of gloves. I would use warm water, or I would use warm water. I would use warm water and soap to gently clean with a cloth. Well, I would use warm water and a cloth to clean the area. Just warm water and a cloth to clean the area. And I would pat dry with the towel. I would not use pre-moistened cloths. And I will place, while I'm cleaning it, I would place a gauze over the stoma if it is draining continuously. After I finish cleaning the stoma, I remove my gloves, perform hand hygiene. I would begin by cutting the wafer and stuff like that, and just how I explained it now. So now I'm cutting the wafer. I did everything. Now I can go ahead and I will peel the sticky part of everything. Let me see. Okay, there it goes. Okay. And then I'll go right in the middle. go. There we go. And I will apply gentle pressure until the paste dries. Once the paste dries, give it a tug to make sure the bag is secure. And then, since this is a drainable pouch, I will get my clamp, fold once. Well, yeah. Fold once. And verify that it is secure. So that is secure. Okay, now just a quick look that my wafer is bigger than my stoma. My wafer is bigger than my stoma. Okay. So that, and then I would discard my gloves, perform hand hygiene, put the bed back to its lowest position, rail up, put the patient back in supine, semi-Fowler position, whatever the patient wanted. Assess for additional needs, call light within reach. My time of return, document the date, the time, and the assessment of the procedure. So that is how you place an ostomy bag. Now, fast forward, I have orders to remove the ostomy bag. So the way I would remove my ostomy bag is I would first look at my orders. I would verify the right patient, the right date of birth, the right time. So I do have Jack Buzzard 6/20/19XX. Today's date, we are doing a ostomy removal. So now that I've verified my things, I can go into the patient's room. I go into the patient's room. Can you verify your name and your date of birth? Okay. Can I see your wrist for me? Can I see your wrist real quick? And so I look at the wristband just to verify, and that indeed is the right patient. So I go into the patient's room, put the bed to a working height, mid-Fowler position, or supine. Rail down, perform hand hygiene, put on some gloves, and I start by pressing down on the skin, press it down away from the pouch, and I go ahead and start peeling it out. Peel. I immediately dispose of my pouch. Dispose of it, and I would go ahead and clean the area. So I would first I would use a warm water with a cloth to gently clean the area, and then I would pat dry with a towel. Avoid using pre-moistened towels. And then I would put a gauze over the stoma if it's draining continuously, and that is how you remove a ostomy bag. Now, if I had orders just to drain the bag, well, let me finish with the removal. So I clean the area. Now I can go ahead and put the bed to its lowest position. Rail up, back to supine or semi-Fowler position, whatever the patient wanted. Assess for additional needs, call light within reach. My time of return, document the date, the time, and the patient's response to the procedure. So I'm completely done, and take off my gloves, perform hand hygiene if I need to say that. So once I do that, if I have orders just to drain the bag, this is how I would drain it. So I look at my orders first. How much am I? I got 24 minutes. So if I would have had orders just to drain the bag, I'll look at my orders and I'll say, okay, so I have the right patient, the right time, the right date of birth, the right procedure. So I have Jack Buzzer 6/20/19XX. Today's date, we are draining the bag. That is the procedure that we're doing today. So go into the patient's room. Can I have you verify your name and your date of birth? Awesome. So I look at the wristband just to make sure. Okay. And then I'll perform hand hygiene, put on some gloves. I want to first assess the skin, the stoma. I want to assess the skin, look for any redness, tenderness, any lesions, any wounds, and I'm gonna look at the stoma, look for any abnormalities, any discoloration, again, any tenderness, any abnormalities, and then I'll look at the pouch to see if it's the correct size, if it's not too tight, not too big, if it's leaking. So once I establish that, I can go ahead and unclamp it. I would save the clamp so I can reuse it for later. I would empty out the contents into a toilet, a bedpan, or a graduating container. I would empty out the contents. I would measure the volume, observe the stool characteristics. Since it is a drainable pouch, I would clean. Since it is a drainable pouch, I would clean the end of the pouch, this part. And then I would get my saved clamp and reclamp it. And I would assess if the bag needed to be changed or not. If not, then I am done with the procedure. If I do feel like the bag needs to be changed, and then I would continue with going to moving the bag, cleaning the area, how I just explained earlier, and then putting on a new bag. So, but this is how you would empty out the contents. Once I feel like the bag doesn't need to be changed, I empty out the contents. I can go ahead and put the bed to its lowest position, rail back up. Well, of course, remove my gloves, perform hand hygiene, put the bed back into supine or a semi-phallic position, whatever the patient wanted. Assess for additional needs, call light within reach, my expected time to return, document the date, the time, the assessment, and the patient's response to the procedure. Let's see if I missed anything. Oh, I don't think that's it. I don't think I missed anything. Ostomy bag. I think that's it. Okay. Well, other than that, I appreciate it.